Autoemotherapy is a therapeutic technique that involves drawing a cc of blood belonging to the patient, which is then mixed with specific substances and with oxygen in the tissues, with the scope of repairing, stimulating the immune system, and changing the metabolism. Then a single sample of a cc of blood is drawn from the main vein on the arm. A little ice is placed on top of the arm to ease the discomfort in the area. Tiny insulin needles are used and a minute drop of blood is drawn, 1 cc. Press down well, please. There you are. Then this blood is mixed with other files that do, however, contain natural substances. This one especially is a file containing arnica and other plants having a remedial action, because in this situation we need to help to repair in this area, let's say the relaxed situation of the tissues in the vicinity of the meniscus and in the vicinity of the shoulders. The patient's blood is mixed with a certain amount of oxygen, usually 3 cc's. Succussion is carried out immediately. In order to fully oxygenate the tens of billions of red blood cells that are present in this small amount of blood. In fact, the blood assumes a beautifully light red color, just like when you blow air into a fire or fireplace. The fire awakens. There is a huge metabolic oxygenization, a transformation of ATP, of all the hemoglobin molecules of the red blood cells, and the hemoglobin is oxygenated. There is a production of ATP. The red blood cells are activated. Now this mixture is then injected. We're doing quite well here. How does it feel? How is the knee doing? Good. Shall we do both the knee and the shoulder? Here we are working on the meniscus. The meniscus is a vascular structure, but injecting blood into this perimeniscal area allows to substantially oxygenate all the ligamentous structural layers surrounding the meniscus. There you are. It is a very simple type of treatment, but extremely effective, because the blood has all those molecules, all those substances, and all those cells, in particular the white repairing cells, like neutrophils. They have a restoring function on the damaged tissues. So therefore we have a cure which almost resembles a small surgical operation. With this type of repair work, which is almost surgical, but using all of nature's means, and blood is one of the most important of these means, the immune tissue, the most effective, the most powerful one that there is. After having bypassed the skin and having injected into the lower perimeniscal areas and underlying tissues the mixture of blood, we can then, with a remodeling treatment, ensure that the blood is introduced along the driving force lines of the knee structure. So, the highly oxygenated blood reaches all the various sites where it is necessary to be. And seeps along all the layers. These bending and extending movements allow a better penetration of one's blood. Within the various structural layers that surround the meniscus. The same kind of assumption may be made with the other disc areas, the area of the internal vertebral discs, the hips, the periosteal areas of the hips, or of other large joints, the shoulder, and so on. The shoulder is one of those joints of an average size, especially subject to great wear in women who do various types of domestic work. Also, to not speak of those women who work in the office. However, it is a complex joint that, where there are alterations of the layers and painful symptoms that even traditional medicine has no remedy for. In this case, autohemotherapy is of great benefit, where with traditional medicine, maybe the desired results are not able to be obtained, or sometimes there is only partial remission. The injection of autohemotherapy permits several advantages. First of all, is a long-term result, with a slow absorption of the blood that is reabsorbed in about 7 to 10 days. Secondly, the blood has an alkalizing action that combats tissue acidosis. Blood has a very strong oxygenating power, the third factor. Where there is rigid sclerotic tissue, stiffness, oxygenization allows for repair action. In addition, oxygen has a huge metabolic power. So then, join with the blood and with other substances and with arnica, we often use cartilage. We use Krebs cycle products. The metabolism is stimulated directly in the area, so inflammatory and sclerotic processes undergo repair mechanisms. How's the shoulder doing? Good. This, with massage alone, cannot be obtained. Therefore, bypassing the surface of the skin, we can get down there with the injection. Then with our fingers, we can get right down deeply. When I began the autohemotherapy treatment in May, I couldn't have imagined the kind of results I would have had. The pains in my right shoulder and left knee were very bad. The fact that the results were lasting was unthinkable beforehand. Previously, I could hardly move my shoulder, as it was almost completely blocked. I hadn't done anything in particular to cause it. It just so happened that it had developed due to age. No treatment was any good. I had tried various different kinds, obviously refusing any kind of medicine because I wouldn't accept this kind of solution. Whereas with autohemotherapy, this is the result. I have regained the movement of the shoulder. I'd say it is almost perfect again. Therefore, I will continue with the therapy. I originally underwent the treatment for about 10 sessions. From the very first sessions, I noticed the immediate benefit, more or less after 10 sessions in 2 months. I am really pleased with the treatment. Yes, I'm really pleased with it. It's like being in a dream. being able to hold my arm up like this, to be able to move it backwards and to be able to rotate it. Can you see it? Did you see that? Getting back to my knee problem, I discovered a few years ago that I had problems with my meniscus, and therefore I was recommended to have an operation. As I didn't consider it to be an emergency, I didn't have any operation. And Dr. Bianchi told me that with autoemotherapy, it would be possible to get the meniscus to heal with time. And therefore, I've been biding the necessary time for the meniscus to repair. When I think back, it used to hurt a little, and it used to swell up, whereas now I can do some quite arduous long walks in the mountains without having any side effects or pains.